Good morning. I am Dr. Kamalam, Assistant Professor of Biochemistry, Sree Balaji Medical College and Hospital. Today I am going to discuss about alcohol metabolism, and it comes under the competency number BI 4.2.1. At the end of the session, students should be able to understand the outline of alcohol metabolism, explain the toxic effect of acute alcoholism and chronic alcoholism, and mention the methods of alcohol estimation and explain the toxic effect of methanol metabolism. Let's move on to the topic. The activity of alcohol pathway depends on the ethanol concentration and the frequency of ethanol consumption. Once the alcohol is consumed, it reaches the stomach where the absorption of alcohol takes place. But major part of alcohol absorption takes place in the intestine. After absorption, alcohol will reach the liver through the circulation. Once the alcohol reaches the liver, alcohol oxidation takes place. The major organ which is involved in the alcohol oxidation is liver. Alcohol oxidation takes place in two steps. First step is ethanol to acetaldehyde formation. Second step is acetaldehyde to acetate formation. Both catalyzed by the dehydrogenase enzyme. The first step of alcohol metabolism is catalyzed by the three kinds of enzyme. First one is alcohol dehydrogenase. Second one is microsomal ethanol oxidizing system. And third one is catalase of peroxisome. So this is about the reactions of alcohol metabolism. The first step is ethanol to acetaldehyde formation by the three kinds of enzyme. First one is alcohol dehydrogenase, which is a NAD dependent enzyme. Here you will be producing NADH. One NADH molecule is releasing here. Alcohol dehydrogenase is a cytoplasmic enzyme and it is a more active compared to aldehyde dehydrogenase enzyme. Then second one is cytochrome P450 oxygenase enzyme. It is a NADPH dependent enzyme. It releases one NADP, and this enzyme is more active in chronic alcoholism. And the third enzyme is catalase enzyme, which is present in the peroxisome. The enzyme activates in the presence of hydrogen peroxide and it releases the two water molecules. Ultimately, ethanol will be converted to acetaldehyde by the three enzymatic reactions in liver. So the first step of alcohol oxidation is over, which is done by alcohol dehydrogenase. There you will be getting one NADH. The second step of alcohol oxidation is acetaldehyde to acetate formation, that is done by aldehyde dehydrogenase. This enzyme is present in mitochondria. So the formed acetaldehyde in the cytoplasm is transported to the mitochondria. There the second step of alcohol metabolism takes place. So here also one NADH is releasing because this is also a NAD dependent enzyme. Here you will get one NADH. So ethanol to acetaldehyde formation yields 2 NADH. Here alcohol oxidation increases the NADH-NAD ratio. So after acetate formation, 80% of the acetate enter into the circulation and reaches the extrahepatic tissues where it will be converted to acetyl-CoA. Then the acetyl-CoA enters into the TCA cycle to produce energy. The remaining 20% of the acetate in the liver will be converted to acetyl-CoA in the liver itself, and it will be involved in the fatty acid synthesis. Whenever more energy is there, our body automatically start the anabolic pathway. So in alcohol metabolism, you will be getting more energy. So automatically all the acetate or acetyl CoA will be involved in anabolic pathways. Next one is microsomal ethanol oxidizing system. It is a mechanism of detoxification of alcohol. Here also ethanol will be converted to acetaldehyde. It is a NADPH dependent reaction. Here you will be getting 1 NADP. This reaction is catalyzed by the cytochrome P450 oxygenase, and this reaction produces more reactive oxygen species, so that will create the liver injury. This enzyme is more active in chronic alcoholism. Next one is catalyst pathway. It occurs in the peroxisome. It is a minor pathway of alcohol oxidation. This reaction occurs in the presence of hydrogen peroxide. So all inclusively in alcohol metabolism, ethanol will be converted to acetate with the production of 2-NADH. So that increases the NAD-NADH ratio. So that favors the conversion of pyruvate to lactate formation, leads to lactic acidosis. This is the last step of glycolysis. So the pyruvate reserve will become down. So less decreased level of pyruvate will lead to decreased oxaloacetate. So there is no substrates for the gluconeogenesis. So gluconeogenesis also will slow down. That causes the hypoglycemia. So decreased pyruvate and decreased lactate, increased energy, that is increased NADH causes suppression of TCA cycle. So the remaining acetyl CoA which is there in the alcohol metabolism will diverted to ketogenesis formation. So that will leads to ketoacidosis, and remaining acetyl CoA leads to the formation of fatty liver by involving in fatty acid synthesis pathway. So in alcoholism, you can see lactic acidosis, hypoglycemia, ketoacidosis, and fatty liver formation. Effect of NAD and NADH ratio. Increased NAD-NADH ratio can be seen in alcoholism. That causes the decreased gluconeogenesis, and increased glycolysis leads to severe hypoglycemia. And more amount of pyruvate will be converted to lactate, so that causes the lactic acidosis. Decreases the fat breakdown and increases the fat synthesis, causes the fatty liver formation. Acute toxicity of alcohol. It mainly affects the CNS. Blood concentration of alcohol less than 5 mg per dl is considered as a normal. Social stage will be between up to 50 mg per dl, which leads to euphoria, but individual will remain sober. Mild intoxication between 50 to 150 mg per dl, that leads to decreased neuromuscular coordination, that people may feel difficulty in driving. Intoxicated stage is between 150 to 300 mg per dl, so that leads to speech impairment. Stupor stage is 300 to 400 mg per dl. Coma stage is 400 to 600 mg per dl. So let's talk about the symptoms of acute toxicity of alcohol. Some symptoms may be feel during drinking, some will be after drinking. So person may feel giddiness, relaxed or drowsy, may feel impulsive, frequent changes in mood, lowered inhibition, diarrhea, slow or slurred speech, headache, nausea, vomiting, lack of coordination, changes in perception and vision and hearing problems, trouble focusing. So these are the commonest symptoms of acute toxicity of alcohol. Let's move on to the chronic alcoholism. In chronic alcoholism, the main enzyme which is more active is cytochrome P450 that catalyzes the reaction of conversion of alcohol to acetaldehyde formation. It utilizes the NADPH and it releases the NADP, and also it releases the reactive oxygen species. Initially, that reactive oxygen species is neutralized by the antioxidant which is produced by the mitochondria and cytosolic glutathione. Later, the more amount of reactive oxygen species will deplete the reserve of antioxidants. So more amount of reactive oxygen species can be seen in chronic alcoholism that causes the oxidative stress and lipid peroxidation, mitochondrial dysfunction and DNA damage. Chronic alcoholism also forms adducts. This adducts goes and binds with the active protein and impair its function. Hypoxia also can be seen in chronic alcoholism. This chronic alcoholism activates the Kupffer cells that causes the inflammation of the liver cells that will lead to liver cirrhosis. In chronic alcoholism, person may consume increased amount of alcohol, so that will lead to increased fatty acid synthesis and decreases the fatty acid oxidation. So accumulation of triglyceride will be more in the hepatocytes that will lead to fatty liver. So person may consume more chronic amount of alcohol intake, so that will lead to increased synthesis of acetaldehyde. Acetaldehyde is a toxic, so that will causes the metabolic stress that increases the lipogenesis and decreases the fatty acid oxidation, and it will lead to fatty liver formation. Then oxidative stress is created by this acetaldehyde formation. Increased lipid peroxidation will be takes place, and decreased glutathione also will be seen in oxidative stress. That causes the hepatocyte injury, that is a liver cirrhosis, can be seen in chronic alcoholism. So in chronic alcoholism, you can see the fatty liver formation and liver cirrhosis. Alcoholism can have an impact on the nervous system due to the deficiency of thiamine. So this thiamine deficiency is maybe because of in chronic alcoholism your intestine cannot absorb the thiamine. So thiamine deficiency can be seen in chronic alcoholism. So that will lead to brain tissue ischemia and cell death. So that will lead to Wernicke syndrome. Wernicke syndrome is the early stage of thiamine deficiency. The symptoms of Wernicke syndrome is acute confusional stage, ophthalmoplegia, ataxia. If untreated, Wernicke syndrome can lead to Korsakoff syndrome. The symptoms of Korsakoff syndrome is amnesia, confabulation, psychosis. The effect of alcohol on the body is memory loss, lack of concentration, depression, hypertension, heart failure, cardiomyopathy, impotence, numbness, bloated skin, overweight. Cancer may be seen in stomach, esophagus, colon cancer, liver cancer also can be seen, and fatty liver cirrhosis can be seen in chronic alcoholism. Let's see about the laboratory findings in chronic alcoholism. If you see the liver function test, it shows the elevated level of gamma glutamyl transferase, increased level of ALT and AST. AST-ALT ratio will be more than 2 in chronic alcoholism. RBC aldehyde dehydrogenase is the best marker for alcohol abusers. Desallylated transferrin or carbohydrate deficient transferrin is the highly sensitive marker for chronic alcohol abuse. Then move on to the methanol metabolism. So methanol is used as an adulterant of drinking alcohol, which can be absorbed via skin, intestines and ingestions. It easily crosses all membranes and is uniformly distributed to the organs and tissues. So it will produce as a metabolic acidosis, CNS and ocular toxicity. Methanol can be used as a antifreeze, inks, dye, dry gases, adhesives, and in films as well. So pure methanol as little as 10 ml can cause us permanent blindness. Now we'll see about the metabolism of methanol. So once the methanol enters into the liver, methanol will be converted to formaldehyde by the alcohol dehydrogenase enzyme. Then formaldehyde will be converted to formate by the enzyme called formaldehyde dehydrogenase. This formate is very toxic. It has to be immediately converted to 10-formyl tetrahydrofolate by the enzyme called formyl tetrahydrofolate synthase. This enzyme is tetrahydrofolate dependent enzyme. Then this 10-formyl tetrahydrofolate will be converted to carbon dioxide and tetrahydrofolate is released. If the person diet is deficient with the folate, then the tetrahydrofolate concentration will be less in the circulation. So the formation of formate to 10-formyl tetrahydrofolate will not be takes place. So the end product will be the formate. So that creates the acidosis, and the formic acid will reaches the retina, and it causes the ocular toxicity, and finally permanent blindness can be seen in the person. Let's summarize the key aspects of alcohol metabolism. Once the person consumed alcohol, it enters into the stomach, there absorption starts, but the major part of absorption takes place in the intestine. After that, it reaches the liver where the oxidation of alcohol takes place. Mainly 3 enzymes are involved in the first step of alcohol oxidation. Primarily alcohol dehydrogenase, second one is cytochrome P450 oxidase, third one is catalase. All these enzymes converts alcohol to acetaldehyde, that is takes place in the cytoplasm. The second step of alcohol metabolism takes place in the mitochondria. So all the acetaldehyde formed in the cytoplasm will be transported to the mitochondria where the second step of alcohol metabolism takes place. Here acetaldehyde will be converted to acetic acid. Then it will be goes to the extrahepatic tissues where it will be converted to acetyl-CoA, then enters into the TCA cycle. Some amount of acetate which is formed in the liver may be involved in the fatty acid synthesis as well. So the major organs which is affected by alcohol metabolism is liver, brain, kidneys, lungs and heart. Thank you all.